Hi, I'm Savannah and I'm going to be administering medication through an IV today. The first thing I'm going to do is gather my equipment, which is some gloves and alcohol pads. The next thing I'm going to do is check my medication order to the medical record of my patient. And then I'm going to clarify any inconsistencies that there may be, and I'm going to check that patient's chart for any allergies. I'm also going to verify the compatibility of the medication and the IV fluid that my patient has. And I would also check a drug book or a resource to see if my medication needs to be diluted before administering it. And then I would also check to make sure I have the right administration rate. The next thing I would do is also, you need to know the nursing considerations, their safe dose ranges, the purpose of the administration, and any adverse effects that the medication can have, and making sure that this medication is appropriate for my patient. The next thing I would do is perform proper hand hygiene, and I would make sure to bring the medication cart outside of the patient's room. I would then unlock the medication cart using a passcode. And at this time, I'm going to check my patient's medication administration record with the medication that I have available. And I would gather the medication that I need. And then I would make sure to check my medication, the expiration date, and I would start to prepare my medication. I'm going to be administering 1 milliliter out of a 3 milliliter syringe. So it will be about 6 seconds per line. And you want to make sure to only prepare medication for one patient at a time. And then I'm going to compare my medication again to the patient's medication administration record at this time. And then I would lock the medication cart and I would bring my supplies into the patient's room. Once I'm in the patient's room, I would make sure to have my meds never leave my side, and I would introduce myself to the patient. Hi, I'm Savannah, and I'm going to be giving you medication through your IV port today, and I would make sure I verify my patient using 2 forms of ID. Can you tell me your first name, last name, and date of birth? I would verify that with my patient. And then at this time, I would also assess and ask about any allergies, even though I did check it in the medication administration record. I would assess for allergies, and then I would do any assessments that I need to do prior to administering the medication given. I would also explain to the patient the purpose and action of the medication given. And then at this time, if I would pause the IV infusion pump, and I would assess the site for any swelling or infiltration or inflammation. Making sure that the patient is okay with administering the medication. And then I would put on gloves after I would perform proper hand hygiene. Put on gloves. So I uncapped my syringe, and I'm going to select the port closest to the site, and I'm going to start by cleaning that with an alcohol swab. At this time, I would attach the syringe, making sure to hold the port with my non-dominant hand. And then I'm going to move my fingers closest to the site, and I'm just going to put the tubing between my fingers so that I can hold it steady. I'm going to pull back on my plunger just until I get blood in the tubing. And then I'm going to inject my medication at the appropriate rate, which would be 6 seconds per line, making sure to administer the medication with a steady and continuous flow. For the purpose of this video, we'll say that the minute has gone by. I then would remove my syringe, and I would put the safety on if needed, and I would allow the IV infusion rate to continue to flow, and making sure to check it if I need to reset it. I then would discard of my syringe into the sharps container as appropriate. I would remove my PPE, my gloves, and perform proper hand hygiene. At this time, I would make sure to document the administration of this medication immediately after giving it, and then I would evaluate my patient for any reactions to the medication.